Hey there, welcome to the Jewish Adulting Podcast. Thank you for joining me today on your adulting journey. Before we get started, can you do me a quick favor? Can you hit the like and subscribe button on whatever platform you're listening to this? I promise it's not a lifetime commitment, but when you don't subscribe, it's kind of like coffee without caffeine. What are we even doing here? Or like latkes without applesauce? Are we even living our best life? When you subscribe, you not only give me warm, fuzzy feelings, but you're also helping me bring amazing guests who rely on subscriber counts to know whether joining me is a worthy endeavor. More subscribers mean more epic conversations for you. And hey, if you're feeling extra generous, you can also show your support by becoming a monthly supporter at buymeacoffee.com/Jewish Adulting. Whether it's $1, $5, $10, or even $20, every little bit helps make this podcast rolling. Of course, if you're sitting on a cool million or even looking to sponsor the show, reach out to me at jewishadulting@gmail.com. Also, I'm always looking out for engaging, thoughtful, passionate guests to join me. So if you want to nominate someone or want to come on the podcast yourself, reach out. Let's make a podcast shidduch.
This is Rabbi Ben-Zion Schaefer of the Shmooze.com. Jewish adulting is about shining a light on parts of ourselves in order to do Avodas Hashem with all the tools and resources at our disposal. It is an honor and a privilege to have every day to further refine our character and grow closer to Hashem. Take advantage of these opportunities before it's too late.
Hello, everybody. This is your host, Edna Rose, for the Jewish Adulting Podcast. I have with me Bunny Dachs, and Bunny has a love for the senior population and is the owner of Bunny's Home Care, cultivating a team of dedicated caretakers that are sensitive and passionate about her team, providing the utmost in senior care and communityship. Bunny has a master's degree in business administration with a focus in healthcare and over 14 years in running efficient systems. So, hi, Bunny. Thank you for being with us.
Hey, thanks for having me.
I first met you a few years ago when we were working on a mutual case. And I think I called you for advice. And at what point during our acquaintance, I started getting the sense that there was like a regular amount of information that people didn't have when they called you. And generally, I know that this happened when I was a care manager, they would call me in a panic. And it's like, oh my gosh, I need an attendant. Oh my gosh, I need home health care. Oh my gosh. And what am I going to do? And how am I going to start? And so, I think I reached out to you as a resource at one point, a few times actually, and we worked together on a few cases. But I thought, wouldn't it be interesting to give this talk, as we are like the sandwich generation of, I know for myself, I'm dealing this with right now with my attendance for my mother-in-law, and I dealt with this for my own mother, and then in a professional way, I dealt with this. So I wanted to sort of pick your brain about these commonly asked questions. But before we get to that spiel that you generally give, the commonly asked questions and all those things that will help guide people in terms of when's the best time to get an attendant and all these kinds of questions that people have. Tell me how you got started in this. How did this Bunny's Home Health Care, how did that come to be? Tell me a little bit about the genesis.
Yeah, sure. So I really started in the healthcare field when I was a teenager. My dad owned a pharmacy, which was actually inside of an adult daycare facility. So I worked as a pharmacy tech in his pharmacy for a bunch of years, and we were just surrounded by seniors there. And that's also, the most common population that comes to the pharmacy in general. So I was doing healthcare, surrounded by seniors. It was great. Then I moved to Philly, where my husband was in Penn Law School, and I got a job working in a startup primary care physician's office. So it was just opening, and I managed the office. So I jumped from pharmacy to medical office, and I was managing running office for a couple of years before I moved to New York, where my husband worked as a lawyer. And there I worked for a nonprofit called the Jewish Community Council of Greater Coney Island, which is an amazing organization, by the way. They provide so many different types of services, but one branch of services that they provide are tons and tons of senior care services. They oversaw five senior centers. They did home care. They did Meals on Wheels. They did family visiting, like so much. They had home care, regular home care, and then they had home care for Holocaust survivors funded by the Claims Conference. They just had a ton. So I was really exposed to like the world of all the different types of senior services that are provided when I worked there at the JCC of Coney Island.
So I really was exposed to a ton of senior care services, and I loved the idea of aging in place. I saw the benefits of it up front, and I loved it. So I moved back to Baltimore a couple of years later, and I wanted to start my own business. I'd gotten my master's at that point while I was working. And I wanted to start my own business in healthcare. And I love the idea of aging in place. So I decided to start my own home care company. And that's really how I got into it.
Okay. So what kind of like obstacles did you face when starting this? Like what was the learning curve like?
So I had like some experience. Like I said, I worked in the JCC, so I was like exposed to how it kind of worked. And then we had a family friend who was involved in home care in a totally different state, and he was, a really big mentor for me. So I was able to really learn a lot from that. And it's a pretty simple business structure. But as you get started, obviously there's so many things that you learn about the way it works, the industry. Also, it's different state to state. The different things you're going to deal with. There were so many obstacles, and then especially a couple months after I started my business, COVID hit. So that was like a huge obstacle,
Oh, wow.
Yeah, I started in June 2019, and then the following spring, or maybe a little bit before then, COVID hit. So I was like, okay, that's it, but then people wanted to stay home and they wanted extra help at home. So we just had to try to adapt and adjust what we did to keep seniors safe at home. And that's what we did.
Right.
The whole thing was a learning curve from the get-go. So then throwing COVID in it for me, it was like, I was like, okay, another way we have to adapt and adjust.
Right.
But it's been amazing. It's been a great, very rewarding thing to do.
Wonderful. So we had similar paths. Like I worked for High, and I was doing the senior home repair modification program and the volunteer coordination. And High is very big into aging in place. They want seniors to stay in their homes longer and safely. And they want to have all these communities. And their whole goal is, to prevent people from having to be forced out of their homes, because that is such an integral part of home health care. There's like a dignity and respect. I just started reading this book over the weekend called, something like Being Mortal or something like that. I don't know. My son is forcing me to read it. But it really does address this issue of how do we keep our parents at home, maintain their dignity, be able to pay for it, be able to have our own lives, some boundaries, not get enmeshed, and all those kinds of things. But
really not easy. It's not easy. It's an easy thing to do.
Okay. But let's get into this though. So like from the beginning, when somebody calls you, what are generally some of the questions that they ask, like top questions that they ask?
So a lot of times people call in a panic. Like I would say at least 50% of phone calls are panic phone calls, that they don't know anything. Their mother fell, she's in the hospital, is coming home, or she just, or their father has had a sudden decline or whatever it is, and they just need help. They don't know what they need. Like most phone calls, like they don't even know what they need. So then you start prompting, how is she with going to the bathroom? You start taking them through all the activities of daily living and asking them, how is her memory? Does she live alone? Does she live with somebody else? Is she okay with walking? Does she use a walker? Does she need help with transferring? Does she eat by herself? Does she remember to eat? What about her medications? So you take them through all the ADLs, trying to find out where they are,
Okay. And for those in the audience who don't know, ADL stands for Activities of Daily Living.
Yeah, activities of daily living. So that's basically what we help with. Home care comes in and we help seniors or really anybody who needs help with activities of daily living. So that's walking, bathing, dressing, going to the bathroom, eating, medication management, those sorts of things. So we try to assess what exactly the needs are so that we can advise what type of help we think they need. A lot of times after we go through that, they'll know what type of help they think they need, like what hours, depending on what their work schedule is and, everybody else's. So it's going through all those details. What do they need help with? What type of schedule do you need somebody to help them with? And then the cost. Like, I think that people who call us that aren't panicking, right? So 50% are panicking and 50% are not. The 50% that are not are usually know all the details about what home care can provide. And they basically want to know the cost. They want to know how we check into our caregivers. They want to know what our company policies are on holidays and all those details, which I'm happy to take you through all the, the basics of what you get when you go with an agent. So those are really, it's like half don't know anything and half already are very, very educated on what it is. And they want to know very specific things.
Right. So basically what we're saying here is that the signs for when somebody needs extra care is when they start to struggle with activities of daily life, like you said, showering and getting dressed, taking medication, remembering things, general help that, maybe it's too hard for them to transfer, whatever it is. That's a sign that you need to start thinking about getting extra support. Right.
At that point, they need extra support already. You really should, like anybody, first of all, if they live alone, if a senior lives alone, and you can't be checking in on them regularly, you should have extra support for them, if, even if you see slight signs of forgetfulness, like they should have somebody coming in to help them because it can get bad fast, if their balance is off. That means that they need someone to help because they're a fall risk. If you see that they're not eating regular meals, that's a sign that they need help because they're not taking care of themselves properly. If they mention they're nervous about showering alone or they're asking you to come over, when they want to take a shower or bath, or you see they're not taking care of their hygiene properly, that's a sign that they need extra help. So yeah, there's a lot of signs. If they're having constant UTIs, that means that they might need help in the bathroom. That's a sign that they need help.
Right.
Yeah, there's a lot of signs, but any of those things is a sign that your family member probably needs additional care. And if you can't be there to help them with it, it's time to call around and start finding out about, how you can get help.
Right. It's whenever it becomes a part-time job, that's going to be a sign that, if you're not able to, all the things that they need from you, they need you to go shopping and they need you to come over and make sure that they've made some food like you said, there are signs there that people tend to wait until it's absolutely, they're overwhelmed, they're flooded, they don't have time, they're worried they're not giving their parents what they need or their loved ones what they need. And then they reach out to you. So.
Yes, definitely. Also, it's also they wait, but also sometimes the parents or the person who needs the care is like, no, I'm fine. That's a lot of pushback because I think that since there's been a lot of talk about this, like seniors getting help earlier preventative, like intervention, helping with these types of things so that they don't hurt themselves and then need more help than what they originally needed. A lot of times the seniors themselves don't want it because they feel like it's taking away a piece of their independence. So a child can mention it over and over again, but then a senior can be very, very against it. Like, no, I don't need this. I'm fine. That's a lot of the struggle that a lot of people who are dealing with elderly parents are dealing with. The pushback from the seniors themselves.
Right. So actually there are a few cons to having an attendant at your home. And the number one con, besides for, the senior feeling, first of all, the senior can feel beholden, like, I don't want to rely on anybody else. I want to be independent. I like my space. There is something about having a CNA or somebody from the outside in your home, and you don't have necessarily like a full agenda of what you're going to need. And you want some privacy, like, there's a difference between being at home by yourself or being home with loved ones and being home with somebody who's essentially a stranger.
Oh, 100%. Yeah. 100%. It's, and that's hard. That's hard for a lot of people, and they don't want it.
Right. What kinds of things would you, to someone who says that, I don't want to have somebody in my house. And I know sometimes people tell me I don't want someone sleeping in the house because, it makes me uncomfortable to have someone here. And I usually say to them, well, it's your safety versus being uncomfortable, sort of pick which one is the lesser of the two evils. Right?
That's not a bad thing to say. Yeah.
I mean, it's kind. I try to say it as nicely as possible, but if your loved one is on, let's say a respirator. Honestly, this was a case I had. Husband was on a respirator at home. Don't ask me why, but that was the situation, and they needed to be cleaning the tubes. I have no idea. I don't know what I'm talking about, but I do know that they needed someone to live in. And they were like fighting it so hard. We don't want someone in the house. We're worried about, socially, and we entertain them, and they talk, and, either they're like awkward or they talk too much. And yeah, I didn't blame them. I completely agree. I mean, it's not a happy situation, but when it comes down to it, if you need full-time care, there's a reason, and you want to stay at home, and that's what your loved one wants, to stay at home, then there is this, you have to sacrifice, you have to balance out, the pros and the cons.
For sure. And I think that, I hear it a lot, especially people who need like a lot of care, like you said, nighttime care or live-in care. Some people are really against it, but you have to really reassure them that you're going to try to find the right personality fit for them. So like you said, they're nervous, they're going to talk too much, or they're not going to talk at all. They're going to have to entertain them. So that, like, finding the right person for the right client really makes a difference when it comes to living, for sure. But you're living, you matching up the personalities. And I tell people, I'm like, we're going to try to find the right personality. You tell us what you think will work for you. Also, sometimes what they think will work for them is not what they enjoy, which is funny because they'll come back and be like, I thought I wanted someone who's talkative, but I can't deal with it. Or thought I wanted somebody quiet, but I'm so bored. I need someone who's going to have a conversation with me more, So you really try to figure out what kind of personality is going to go with this client and going to fit what they think their needs are. And that really makes a difference, because that can change their attitude from this is so uncomfortable to, wow, this is so pleasant. I have such a pleasant person around, and they're really making me feel safe and secure. So that can make a difference in some, not every situation, but in some situations it really, really can. I had this with, one of my first clients, who was my client for a while. She was having 24-hour care, different caregivers coming in every 8 hours, I think it was. And she needed round the clock care. Like, she needed somebody awake at night. But it was too much for her. There's so many people coming in and out, too many personalities. And it was not benefiting her. So we ended up, we were starting to fill in spots for this client, like this slot here, this slot here, like different shifts, I should say, like 8 to 3 this day, 8 to 3 this day. And she met one caregiver, and they clicked. Sometimes it happens, and they click. And this caregiver ended up becoming her living caregiver for a few years. And we had somebody else come and do the night shift, so the living caregiver could sleep because someone needed to be up at night. But the quality of this client's life, I can't even tell you how much it improved when this special caregiver took over the case and lived in with her. He did things with her that nobody thought this client was capable of doing anymore. And the quality of life, it was unbelievable to see how that clicked. And she said before
before we started the live-in, she's like, I don't think I can deal with one person all the time. It's going to be too much for me. The client said this. She's like, it's going to be too much. I'm going to get sick of them. So I was like, okay, if that happens, we'll take her off, but give it a shot. And it was just for years until the client passed. They were best friends. So it really, it can really make a difference. And I tell people this all the time when they call. They also want to know, are there going to be different people coming? Is it going to be the same person? Do I have to stay with that person? So I say, listen, we want to keep the same person on your schedule. We don't want different people constantly coming every other day. We want it to be the same person so that you can build a relationship. But if you do not like that person, we will look for another person. You do not have to stay with that. It's not like a marriage contract, If it's not working, we'll switch it. That's the beauty of going with an agency. One of the beauties that have options. And sometimes the relationship will start out beautiful and it will be beautiful for months. And then something will just go wrong and it's not working anymore. And then you have to change it up. So, yeah.
Okay. So let's see what is, I think probably the first thing people ask you as well is what can I expect, from an agency. And one of the things you just mentioned is, we're coordinating the schedule. We're trying to find the right shidduch for you. We're trying to,
Exactly.
And,
yes.
And then what are some unrealistic expectations that people have?
Yeah. Okay. That's a very good question. That's a great question, actually. So from an agency, you can expect that, we do all the research, we do all the background, we do the reference checks, we do the interviews, we do the orientation and training. We have the nurse overseeing, we have a registered nurse who creates the care plan for each client. And then she oversees all the care. She reads the care notes that the caregivers put into our system every single day. If there's an issue, she'll call the family, she'll call the client. She's overseeing all the care. So there's all that management that's being done on our side of the caregivers. If there's an issue with the client and the caregiver, the agency is contacted and then we try to manage, if there's problems, something's not going right, something's not being done right, they call the agency. We try to talk to the caregiver, try to work it out. Communication is very important. We deal with the daily schedules. So if the caregiver needs to take off, he tells us, we find a replacement or we don't, depending on what the client's preference is. We deal with paying the caregivers, right? So benefits, minimum wage, all those things that people need to worry about. If they have a private caregiver, they don't need to worry about that. That's on us. There are W-2 employees. We take care of all that. If the caregiver ever calls out, we try our best to find a replacement. Now, this is, something that people expect from agencies, that they will always find a replacement. I always tell them, there's no guarantee. We try our best. We do have a roster. We have a lot of people that we can call and we try. But sometimes it just doesn't work. Sometimes there's just nobody to come fill in. So under the expectation, what you were saying,
yeah, right. That's one of those hard ones because, gosh, if somebody is a vulnerable senior, if I could, I couldn't even count. If I had $1 for every time somebody called out, sick or unable to come, whatever it was for my mother, who we had an agency for, there was literally nobody. And that is a really difficult position to be in. And it happens to be that because of training, because whatever, I was able to handle wound care and other ADLs for my mother, and I would come over and I would do it. But it always was a tricky situation because on the one hand, this is a very vulnerable population. On the other hand, if you can't find somebody, you cannot find somebody. There's only so many laws of physics you could try to break. Just a person there, what can you do? What can you do?
So I always tell people, like you said, you try your best, you try every which way to get somebody there. But if somebody can't come, that's also, you have to realize it has to be somebody that's skilled enough to handle that client. So let's say the client, like you said, your grandmother, for example, had wounds, right, that needed special, you need to know how to handle those wounds. So not every caregiver is trained in everything. So you're going to have a caregiver, but you're not going to send her if she's not trained to handle that client, you know? So the stars have to line up, and most of the time we do staff it, but there are times where we don't. It doesn't feel good when we're not able to. We feel terrible, but I always tell the clients, I set the expectation. I don't want to set unrealistic expectations with my clients. I want them to know this is how it works. If someone calls me and they have a 24-hour client and it's a complicated case, I always say they should have more than one agency, filling all the time, because this way, if one agency can't staff, the other one hopefully can step in. The more resources you have, the better. I work with other agencies all the time. We like to work together. It's not a bad thing. But I always think there should also be a family member available to step in just in case things do happen. Like, I'd love to guarantee it, but I just can't. And that's an unrealistic expectation that a lot of people have from agencies. Like, we can step in a lot of the times. Sometimes we can't. It's just a fact of life, like you said, you can't create stuff out of thin air. So,
I've always found that the more you set realistic expectations at the beginning, you feel like a bad guy. You feel bad that you're saying like, hey, look, if I can't get you somebody, who in the family is going to be, plan B or plan C. If I can't get another agency and they can't find a friend of theirs who's vetted and who knows how to do a deal, you have to have, it's better to have that uncomfortable beginning than during the incident and be like, well, I never promised you, it's like, no, just right. Right. People don't know when they can expect.
100%. Setting realistic expectations from the outset and from the get-go is so important. And I think that anybody who's listening to this should hear that if an agency promises you, they can always staff it. Like, it's just unrealistic. It's an unrealistic expectation. And I think more and more agencies are trying from the outset to make sure that that's a known thing, that like, we will try our best, but there is no guarantee, even still, like, even when you say it, still people get upset. Well, that's why I use an agency. Like, there's a lot of reasons to use an agency, and a lot of times that can be a benefit, that they can help staff a call out, but sometimes they can't. So if that's the only reason, like, then I feel bad, but
Right.
So another unrealistic expectation, since we're on that subject, is that, the caregivers do light housekeeping, right? So we run into this issue a lot where there's like a very, very gray area. What is light housekeeping? And it sounds silly, but it comes up so much. I'm sure you hear this too.
Yeah.
Right? Like, what is light housekeeping? So, like, to break it down is not so simple, because first of all, you can say light housekeeping is okay, like cleaning up in the bathroom after the client, like washing the dishes, folding the laundry, you can name basic things, but sometimes you'll have caregivers that like enjoy cleaning and don't mind going above and beyond light housekeeping. And a client will give them a list of things to do, like scrub my floors, clean out my fridge, which is not light housekeeping. And they'll do it. And then they'll have that expectation going forward, of everything else. But you're like, that's not light housekeeping. This caregiver did it. So I try to tell people that also. Light housekeeping is laundry, dishes, essentially. I'm like, and I say it's a gray area, but it's laundry, dishes. They can sweep the floor, they can clean up in the bathroom after you. That doesn't mean they're cleaning all the bathrooms in your house after all of your kids and your grandkids. That's not what it means. And it also doesn't mean that they're washing all the dishes after, your Shabbos meal or whatever it is. They're cleaning up after the client. That's their job. Right. Setting those expectations, because we've had a lot, dust the windows. I'm like, that the dusting, that's not, you need a housekeeper for that,
Right.
Right. But it's also important for people to understand, besides the fact that this is their profession. They're certified nursing assistants, geriatric nursing assistants, certified med techs. They have professions. They've gone to school for this. They have licenses. So when you start treating them like a cleaning lady, it's demeaning to them, like they will do it housekeeping. That's part of their job. But treating them like a cleaning lady and like you come in and all you want them to do is like get on the floor and scrub, it doesn't feel good for them. It makes them feel like you don't respect their profession.
Right.
Right.
And then there's also the unrealistic expectations around Yiddishkeit and observance.
Yeah.
Let's talk about that. What is realistic for a CNA to know about Jewish observant life?
Yeah. So we do like a kosher training for all of our caregivers that come through. And I try to, explain to people it's a kosher training. We explain that there's a separation of milk and meat in a kosher home. And we try to explain it to them. We give them like an overview, but they are in no way experts in kosher. And you cannot expect them, after learning about it for 20 minutes, to be an expert. We've been doing it all of our lives. And if I walk into your kosher kitchen, I probably will use the wrong thing because your kosher kitchen is different than my kosher kitchen. That's just the way it is. So they have the basic knowledge, but it's still very new and it's still very hard to, apply properly to everything. And I think people expect that they come in and they're experts, and they're not going to be. That's the reality. Even if they have this basic knowledge, applying it is another step, and being patient with them and showing them, okay, this is the milk side. If you want them to be in the kitchen. Now, some people want them to stay away from the kitchen, which that's fine. We have the problem of, there's a few problems. There's a problem of them helping with meal prep, right? So they actually have to do stuff in the kitchen. And then there's the problem of them just bringing their food in the house for them to eat.
Right.
So if you want to help with meal prep, that's more complicated, but you have to just show them milk, meat, everything has to be labeled. You can watch them. You have to trust them that they'll wash the dishes in the right sink. People have to set their own expectations. If they want that, it is going to be harder on them because they have to manage it a lot more. Where most people won't even have them do that. Most people just run into the problem of them, the caregivers, bringing their food in to the client's home.
Right. What's a good way to handle that? What have you found that people do that makes the most sense?
So a lot of people will talk to the caregiver and say, what do you like to eat? And they will buy them food from the supermarket and they will have it in the house for them. Snack, lunch, they'll have food for them. A lot of people like doing that, and it works. It works sometimes. Some people don't want, food from other people. They want to bring their own food. They want to have their own food. So in that situation, I've spoken to a lot of rabbis about this, and I always tell people, talk to your rabbi. There's more options than you think there are to deal with this. People think that it's like all or nothing, but that's not it. Talk to your rabbi, tell him the situation, and he'll give you good advice. A lot of rabbis say have a special designated room that's not a room regularly, used for eating, and that's the room the caregiver can eat her food in. A computer room, a study, whatever it is, a room that you feel comfortable that you don't usually eat food in, that she can eat her food in there. If she can sit outside. You can give her a 20-minute break to go somewhere and get something to eat. There's really a lot of ways you can make it work. A lot of people choose to get a microwave special for the caregivers. They can heat up their own food in a different room, which I think is wonderful because that makes the caregiver not feel like a second-class citizen. You know what I mean? You can't touch any of my kids. It doesn't feel good. And, you want them to feel respected and loved so that they'll provide the best care possible. That's how you're going to get the best care for your loved one. It's you treating them with respect and being nice to them, So if you are, most of us are super crazy about our kosher kitchens. We have to be very strict. So talk to rabbi. This is always, I say, talk to your rabbi, tell them what's happening, ask them for advice. Should I need rooms? Should I, when the weather gets bad, I had some clients who are like, we only want them to eat outside. I'm like, but it's freezing outside. Let's think about this. You want her to go outside in the 10-degree weather to eat her food? Can we come up with food? So it's really working with the agency. I always give people a lot of options when they're not sure what to do. And this is the first time they've worked with this. And then I always tell them, talk to your rabbi. The rabbis deal with it all the time. They're really smart. They have really good solutions for all this. I promise. They really do.
Right. And then, something that I noticed, I never really got what was the right etiquette for this. So now that I have you on the line, I'm going to ask you, what is the proper etiquette for CNAs that come to shul in terms of, well, first of all, there's two parts. One is for them being a Shabbos guy. That's problem number one, which you might or might not be able to answer that question. But problem number two is, them being on the phone during the services. What is a realistic expectation is it okay to say to, your CNA, you cannot be on the phone at the synagogue? It's just not respectful. Or it's like, well, they're not Jewish. It doesn't matter. I mean, what is generally.
Right. So it's interesting because we also, in addition to the kosher training, we do talk about Shabbos as well. Because, it's kind of a weird thing if you're not Jewish to go into somebody's house on Shabbos and you're like, what is going on here? Nobody's on their phone. Nobody's driving. So we give them a little bit of an overview about what Shabbos is, what it means if you work in a Orthodox Jewish home on Shabbos, like what to expect. And we talk about this. We actually touch on this, like if the family invites you to come sit at the table while they're eating, put your phone away out of respect, so it's a respect thing. And it really depends how you frame it, with anything, like the way you talk to people, it really makes a difference in how they're going to receive what you're saying. So if you say, in synagogue, if you escort a client to synagogue, if you need to take a call, just step out of the synagogue, out of the building, out of respect, because nobody else there is using their phone. So it's just more respectful to step out, and or whatever it is, people tend to say things sometimes and they're not sure how to say it and it doesn't come out right. And then everyone gets frazzled. So it's okay to tell them that. You just have to explain why, like, this is a place, this is like a holy place on the Sabbath where we don't use any electronics. And even though you're still allowed to do whatever you want, but just out of respect for everybody, would you mind, just if you have to use it, just stepping outside of the building,
Right.
Just about how you frame it. And people are okay with that. People want to respect your religion. People want to respect you. They are, people really do love working with Jewish people because they respect the religion, they respect the tradition. What caregivers don't like is when they don't feel like they're treated with respect because they don't fully understand the traditions or they don't fully understand why what they're doing is wrong. But not presented properly. So to answer your question, you for sure can say something and explain it, but I think the most important part is to explain it and say it in the right way, where it's not as if you're attacking them, you're just trying to explain, this is just about respect and religion, and we don't normally do this, and to respect the synagogue and the holy place, all that type of stuff.
Right. Do you ever counsel or tell the clients or tell the caregivers, like, no talk of religion, because I could see that getting sticky?
I think we do in orientation, we say, don't talk about religion, don't talk about politics. Does it happen? Of course it happens sometimes, but we tell them in orientation, try to stay away from those discussions. Like, it doesn't help anybody. It's not important to your relationship with what you're doing for the client, how you're helping them, how, they're a part of your life. But we do tell them to try to stay away from it. However, we have to talk about Judaism because a lot of our clients are Jewish. So they have to have this basic knowledge of what does it mean? Like, a lot of my caregivers come in and they're like, oh, I know what a Jew is, and they think it's like Hasidic, that's what they think a Jew is. Like, how else would they know? Like, a lot of them that grew up in Pikesville know exactly, a lot of them have Jewish friends or they know Jews. So you have to explain it to them so that they have the basis that when they're going into someone's house, they kind of understand whether it's like a more modern Jew or a very religious Jew. They kind of understand what they're going into a little bit. So we do have to give that orientation. That's why we have an orientation for our caregivers, so that they get that base and that knowledge, and then they get to meet me and I say, I'm a Jew, and they say, are you a Jew? Yep, I'm Jewish, see? No shame.
Even the blonde hair and the blue eyes.
Exactly. They're like, you're not a Jew. I'm like, yep, I'm a Jew. See, we come in all shapes and sizes. You never even knew. So, yeah. So it's just, yeah, exactly.
Do you have any in all of this talk about what they do and what they don't do and religion and everything like that, do you have any stories where this worked really well or this did not work very well? That the whole idea of boundaries around these issues, around cleaning, around religion, around tasks that they can do.
Yeah. So I'm trying to think. Every case is really a case by case basis because it really depends on the client you're dealing with. Also, like, you have to deal with everything so differently depending on the client and the caregiver and the personalities. And So something that may have worked for one client and caregiver may not have worked for another client and caregiver, but, we had a live-in caregiver at a very religious client's home, and the client wanted to feed her so that we didn't have to worry about kosher, and she was living in, so it made sense. So she was there, and she was working there maybe for about a month or two. And then the caregiver called us and she's like, I just don't like her food. Like she's used to eating a different type of food. Jewish food is a type of food. We ate a different type.
Yes, I've been told gefilte is disgusting. That's right. Word on the street is it's disgusting.
Right? Well, some of them like it, but not everybody. It's not everyone's taste. Right. You had to go with, spiced African food. You might not like it. And I understand. So, look, I really don't like her food. I'm like, okay, let's try to figure out a solution. So, and she's living there, so she cannot cook in her house. She's like, I will cook my own food and bring it, but I need a place to warm it up. So, got her a mini fridge and we got her a microwave, and she kept it in her room that she slept in. And she made her food every Sunday. She would go home, make her food, come back, and she would keep her food in her room for the week in her mini fridge and in her microwave, and that worked for everybody. Right. So I feel like we're always coming up with creative solutions depending on the case. We always have everything, In terms of cleaning, we had this client once who, he needed minimal care. So he was like 4 hours a day, 5 days a week, but he needed that care. The minimal care that he had, he needed. He needed someone to help put on his compression socks, and he needed someone to help him, stand by while he showered. But there was some downtime. So he wanted the caregivers to deep clean. He really wanted them to deep clean. So he came up with this comprehensive list of cleaning, of what the caregivers should do. And it was intense. Like I looked at that list and I'm like, wow, that's an intense cleaning list,
I don't even do that in my house.
I don't do that in my house. I'm like, when was the last time that was dusted in my house? Or, But and one of the caregivers was like, so how do you do it? She's like, I want to sit around and like whatever. I like cleaning anyway, so I'll do like these crazy cleaning things. But a bunch of the caregivers were like, I'm not doing this. This is not my job. So it was very, very hard because trying to explain to him the gray area. So we take that list. They texted us the list, and we had to take it, and we had to just go through with him like what was that kind of part of their job description as light housekeeping and what was definitely not,
Right.
Helping. So each client really it's really a case by case thing. It really is.
Right. I think that's part of one of my favorite parts about care management is how unique each individual case is, and how you have to be creative in problem solving. What are some, let's say, when you said that you interview and you vet and you go through the process, but what are some difficulties you encounter when you're trying to hire a caregiver?
Where to start? So,
where to start? So many.
Well, it's a hard market because, finding good caregivers is not easy. So, to start off with, getting people coming for interviews is a lot of people that with this type of work, it's shift work, right? So they work in shifts in different places. A lot of them work for multiple agencies at the same time. So getting them to come in at a time that, they're not working or they have coverage at home with kids, that's hard. And getting them to come in at all. Like anyone that owns an agency will tell you, like a fraction of the interviews that you actually set up end up coming in for the interview. Like you can have 10 interviews set up for one day, and maybe it's a good day if 4 people show up. And that's not an exaggeration. That's just the type of work. That's just how it goes in this industry, unfortunately. So the first is getting people to come to the interviews. Then once you have them for the interviews, you need to have good references. If we like you, you made a good impression, you seem professional, punctual, you have to have good references. So then you have to get in touch with references. Sometimes that's not so easy. If they're working, if one of the references is a big company, a lot of times they won't really give a reference. They'll just give dates of work, which, those are some legal HR stuff that some of these big companies follow, but that doesn't really give me feedback on how well she did her job, you know?
Right.
So getting a good reference is sometimes hard. And then all the documentation that we need from them before they can start, it's a lot. So getting them to bring in all their stuff by orientation and then even show up for the orientation. Those are all obstacles in the way of hiring caregivers, all of those. So, you have to have a good reputation as a company, because I see that the best caregivers that we hire, I've heard about us from some of our other caregivers, and they, the process is much smoother with them. They get all their documents in, we follow all the state rules to the T. So they have to have, there's a lot of documentation you need in order for them to work for you as an agency. So, getting all that done. And then they need to have, a clean background, which most of the time, by the time they get up to that part of the interview and hiring process, if we like them that much, they normally don't have a bad background. Like their background's clean, you can tell. Once you've been doing this for a while,
Right.
So yeah, a lot.
Okay. Right. So let's see here. So in terms of, let's get to the real thing that everyone wants to know. Who pays for home health care?
It's a great question.
Everyone wants to know.
Everyone wants to know, yeah. So right now, Medicare does not cover this type of home care. This is called non-skilled home care, help with activities of daily living, and Medicare does not cover it. So people get very confused because there's home health care and there's non-skilled home care. What I do is non-skilled home care. Home health care is PT, OT, speech, skilled nursing by an RN, and that's different than what I do. And Medicare does cover home health care, PT, OT, speech, RN, after a hospital visit for a certain amount of days. But it does not cover non-skilled home care. Okay, so that's the first clarification that I have to make with most people. Doesn't cover it yet. Hopefully sometime in the future it will, because it will end up saving Medicare a ton of money by preventing hospital visits and stuff like that. But right now, Medicare doesn't cover it. Medicaid, which is the state insurance, has a waiver program, community options waiver program, that you can get on if you are under a certain income level. But it's very hard to get in the waiver program. It's really not simple. There's a long wait list. It takes months and months and months, but that is an option. But besides that, which most people don't have, it is either you pay it out of pocket or you have a long-term care insurance policy. And a long-term care insurance policy is similar to like a life insurance policy that you would have paid for, 30 years prior, and you've been paying it every year. So thankfully there are a lot of people who did purchase long-term care insurance policies. And that's another benefit of working with a home care company or an agency, is that we really help people with their long-term care insurance policies. We help them, open up the claims. Whenever somebody calls me and they tell me they have a long-term care insurance policy and they want to start the claim, I give them all the background before they call, because to be honest, the long-term care insurance companies didn't realize how long people would live and how much money they'd have to pay out. And they don't want to pay it out, so
Right.
They'll do what they can to deny the claim or to stop the claim from paying out, stop the policy from paying out. So I try to warn everybody, like, they are not your friends. You need to, really, I said they're not your friends. They're going to do an assessment on you to see how much help you need. And, the problem is a lot of seniors, even if they need help with things, they don't want to say they do. So they want to seem more independent than they are. And when someone will do a phone assessment or will come out to do an assessment, they'll say, oh, I can shower by myself. Oh, I can go to the bathroom by myself. Meanwhile, they will not shower without somebody standing right outside the door or right outside the shower because they're scared they're going to fall. So I say, I tell the kids mainly of the clients, because that's really who, I say, be there by the assessment and be honest. Be brutally honest about what the needs are. oh, I have to stand there when mom showers because she's nervous she's going to fall. That's why we put the grab bar in. That's why we have the shower chair. They need to see what the needs really are so that you can use your policy. Don't sugarcoat the needs. That's what I tell people. Don't sugarcoat. Be brutally honest about what the needs are so that you can get your policy to start paying for the care you desperately need.
Right.
And I take them through that process. I tell them, find out what your daily allowable amount is. I don't know if you want to hear all these details or if it's important.
It's interesting to me. Go ahead.
So most policies have a daily allowable amount, which is an amount of money that you can spend every day up to that amount. So let's say it's $200 a day. You can spend $200 a day on care, right? So let's figure out what hours you can do if you want to stay within your policy limits, right? Most policies are daily. Some policies have a monthly allowable amount and you can spend it over the month however you want, but that's more rare. More common is a daily allowable. And then you also have a lifetime amount of the policy, right? How much money do I have on this policy? I can spend $300,000 and a lot of times it's over a certain amount of years, over 5 years, right? And I can only spend $200 a day. So right there helps you figure out, what your costs, what you can get out of this the most you can get out of this policy, right? What it's going to pay for. So finding out those things are really important. Finding out if there's an inflation rider, right? Does my policy go up every year for inflation? Most policies do have an inflation rider. When does that inflation rider become active? Is it every January? Is it every April? Because that's when I bought the policy. And then the percentage. So this is how you know, okay, so this year my plan is $210 a day instead of $200. And that could change things for you. That could give you an extra, who knows, depending on what you were doing, extra hour. So those things are important to find out. Another thing is a lot of policies have like a deductible. It's called an elimination period. It's the same thing as a deductible. You have to pay for the first 30, 60, 90 days, whatever it is. Every policy is different, out of pocket before they start paying for your care. So that's another question I tell people to ask when they're calling to find out about the policy. And then if they're ready to move forward and they want to go with us, I say, these are the options. Either in terms of getting the money from the policy, I can send you a bill, you can pay me, and then I'll send the documentation into the long-term care insurance, and then they'll reimburse you. Right? Option number one. But option number two, which most people like, and I prefer it too because it just keeps things smoother, is that the client can ask for an assignment of benefits. And it's a form that you get from the insurance company, and they assign benefits to the home care company. They assign benefits to me. You fill it out. I fill it out. I'll send it back in. And then what happens is I bill the insurance company directly and they pay me directly, and you don't have to worry about it. You will see everything, get all the EOBs. You see everything I billed. You see everything they paid, but you don't have to lay out the money and then wait for it to get reimbursed. And if there's an issue with 1 day of service that they were missing a note or something and they need me to resend it in, they'll deal directly with me and you about that, and then I will be able to send it in. So that's usually the simpler option for most people. And I would say most policies do that. I've recently had 2 clients with a specific policy that the assignment of benefits was just like impossible, and it didn't make sense to do it because of the way they paid it out. So they're laying it out. But every policy is different. So don't assume you know your policy unless you've asked every single question, and, read the fine print and ask as many questions as you want, because it's important to understand your policy and make sure you take the name of the person who gave you that information and the date and a reference number for the call, because sometimes people call and get different information. Second time you call, it's, you want to be on top of that.
It's a lot. I want to just validate anybody who thinks this is a lot. It is a lot, and it's going to take, you need a lot of siyata dishmaya. You need to find the right person or the right agency, and to be able to pay for it. All these things have to come together to make sure that your loved one is cared for and safe. And it can be overwhelming. And like we just talked for like 40 minutes about just the basic fundamental, like what to do, what not to do.
Right.
You know, what kind
There's so much we didn't talk. There's so much we didn't even touch,
Right. What let's go there right now. Because I don't want to, is there anything that, because I don't want to take any more of your time, but I want to make sure that if there were some things that you definitely want to get to, what other things do you feel like the audience should definitely know about?
I think that something they should know about, like a lot of people hire private caregivers, like not through an agency, which is great for some people, works great, but they just have to understand what that means. Like they should definitely do background check on everybody. You can, go online, find background check companies and pay for a background check. You should definitely do a background check on anybody that comes into your loved one's home. Get references, always references, always background check. And just know that you're going to be, when you're working with an agency, they sort of partner with you to care for your loved one. And here it's all going to be on you, which it works for some families. It really does. And sometimes it's the right option. But just understand what it entails, you're still subject to overtime. Like if your caregiver works overtime, legally, you still need to pay them overtime. Even if you're hiring them limited. And a lot of people don't realize that. You're still required to pay the minimum wage. So I think that's just important for people to realize when they're hiring privately, to realize those things. And I think it's good for you to talk to multiple agencies when you're hiring. It's good to hear what agencies have to do. I also did want to touch upon like agency norms, like you were saying.
Yes, that was one of my questions. Yes.
So agency norm is that, there's usually a client service agreement. People are never fully it makes people nervous to hear that. But I try to explain, like, service agreement is not a binding contract. It says in the service agreement, the services we're going to provide for you or your loved one. And it says in there that, when you're ready to stop services, you give us 48 hours notice and that's it. Done. You're not bound to us for months or years. It's just 48 hours cancellation notice. And that's all you need. There are holidays that are charged time and a half. That's an agency norm. And that is because if people are not paid time and a half on holidays, they're not going to want to work. That's just the reality. So most agencies do charge time and a half on holidays. The service agreement also says the rates, what's going to be charged. Most agencies charge a deposit. So most agencies take 2 weeks now. Some agencies still take a week worth of service as a security deposit, and that will be applied to your last week of service with the company. That's very normal in the agency. When you are talking to agencies, it's important to find out if their employees are 1099 employees or if they're W-2 employees. 1099 means that they are independent contractors, and the agency really doesn't have any management over them. That's what it means. When they are W-2 employee, it means they are an employee of the agency, and the agency manages them and pays employer taxes on them and all that stuff. So it's a very different type of employer relationship. And most agencies are have W-2 employees that are employed by them because, you need to be managing your employees, and that's the way it should be for a home care company. But there are still that have independent contractors, but that's a totally different type of model because independent contractors are not managed. They're kind of contracted out to you. So instead of you finding a private home care aide for yourself, you'll call this, I guess it would be called more of like a registry. And they'll send you a caregiver who's an independent contractor, but they don't take any responsibility for that. All their taxes and all their hours, like that's on the client. So important to know those differences when when you're dealing with an agency.
Right. There was actually, you're reminding me, like a while ago, I was speaking to, when I was first like curating and finding different names of, so that I could have backups and that I could ask for, different holidays. And I was trying to get a whole list compiled of CNAs. And I came across this agency, and she says, we're not an agency, we're a referral service. And I said, okay, how do you get paid? And she said, we charge the CNAs like a month or something of, have you ever heard of this? I'm trying to remember what it sounded sketchy as anything is where I was going with that.
It probably is. But they charge them like their first month of what they make, or
yeah. It's like you don't.
I've heard of like these types. Every like referral service does something interesting. Like I've heard of referral services that, if you're the client, you pay the caregiver whatever their decided rate is, and then you pay the referral service $5 a day or $5 whatever it is, or $50 a week ongoing or something like that. So all these referral services have different arrangements. I don't know, like, most of them seem sketchy to me because, like, you're going through an agency, the whole idea is that you want them to manage the caregivers and the schedules and, do the background and all that digging. So, yeah,
that actually leads me to kind of a sticky question. I don't know if I should be asking this on a podcast, but I'm going to do it anyway. Because I like to live dangerously. There are agencies out there that are tremendously inexpensive. I mean, a little on the ridiculous side.
Yeah.
And they get in people. I'm not going to name agencies and I'm not going to name locations, but they get people who are on visas, let's say, and they come with very little skill and very it makes me so nervous. And I've had clients who are like, I'm absolutely not putting my loved one in the care of like this kind of how like, I don't even know what question I want to ask here. It's like,
I tell people
ethical use of, I don't know. I don't even know the question.
No, it's funny because it comes up often. Like, and I tell it's expensive. If you don't have long-term care insurance, going through a legit agency, it's expensive and it's only going to get more expensive. And it continues to rise as everything else rises in this country. The cost of everything rises, so does home care. And it's expensive and it adds up. So people that need this care or need live-in care specifically, and they cannot pay for a legit agency, like I feel like they just feel like they're backed into a corner and they don't have any other choice. And sometimes you will get somebody fantastic, right? If you're bringing in tons and tons of people, sometimes you'll get a gem, like you just will. But you might have to go through like 7 horror stories to get a really good caregiver because, like you said, they're very little skills, no background check. I mean, short visas, whatever it is, it's a situation. But I think that people do it because they just don't have the resources to do it with. And what are you going to say to that? I mean,
right.
I really suck. People put me all the time like, what do I do? And I'm like, I wish I had unlimited resources to give everybody, but right. I see like when you do it legit, it's going to cost a lot more because you're doing it legit,
Right.
So, and it's really tough. It's really tough. Like, but you will have some good stories. So that's what I want to say. Sometimes there will be good experiences with that type of care, but sometimes you will not have good stories. And I think the people that do it just usually don't have a choice, honestly, because they don't have the resources.
I think, and again, I don't know if I should be saying this on a podcast, but I think to me, it feels a little bit unethical because if they're charging me nothing, what are they paying?
All right.
That to me is like a big deal because first of all, what kind of job satisfaction do these people have if they don't feel appreciated and they feel taken advantage of?
Yeah, but right, that is also coming in from other countries where they're barely making anything, so this feels like a lot to them.
Right.
Also, like
you're much more forgiving than I.
They also can't get a legit job here, these employees, because they don't have work authorization. They're coming in with tax IDs and they're working under 1099s. So they can't just get a job anywhere. So the fact that they can get a job and even make that money in US dollars is good for them. So, you have to think about it from that perspective. I don't think they feel like they're being ripped off. If they end up staying here for longer and seeing how other people get paid in the same profession, they'll feel ripped off. But that's not the case. They just don't know. I'm not forgiving. I'm just accepting of the situation for what it is. Like, I think
I think that's a really good attitude. You're showing me the other side of the story, that it's not just one dimensional of like, how dare they, the ethics and the audacity. It's like, no, these people, for them, it could be a good situation. Yeah. And it also helps people who are in a tough spot, who don't have long-term care, insurance, and who money, have to pay out of pocket. So I think it's very generous to have such a, open-minded, sort of realistic view of what other people need to have. So in the best case scenario, you find a reputable agency. They do all the vetting for you. They do all the training. They handle all the uncomfortable, things that family members, it's, one of the other benefits, one of the other pros of an agency is that when there's a relationship between the caregiver and the client, and if the client has something that they want to ask the caregiver to do, but they're worried about how that's going to come across or the relationship, and they're now kind of, I don't want to say beholden, but this is the person who's taking care of them. And so it's a really tricky situation to be in. Having an agency to sort of be, like, this is our policy, this is what we need you to do, is really a nice, it's huge. It's like you get to, I will just be, I'll be the good guy and I'll be like, sure, whatever you want to do. And then you go, sorry, that's not our policy. We don't allow that. That's a big role. I find that I always say I'm the bad guy. Say like, the care manager doesn't let me do that, or oh, Khadra said she needed this. And I definitely have found that being the intermediary between the two, even if they can have a conversation directly about scheduling, about payment, about, it can get a little bit tricky because people are very vulnerable.
Yes. And it's also good because a lot of times you understand the people you're dealing with and you're able to phrase it in a way where you show them that it's like, to the caregiver, that it's also for their benefit. It's not just for the client's benefit that you're telling them not to do this or to do this. It's for their benefit as well. Right. And you sort of have that, that third person view of the relationship where you know what to say and how to say it, and in a better way, where he's in the wrong way. So
I'm sure you have a lot of clients who are like, oh, can I ask them this? Can I ask them that? I'm sure you have that. I had that all the times. Is it normal for me to say, come in a little later, or it's like you can ask them whatever you want. They might say no. There's so many times where it's like, for what would have been a normal interaction between one adult to the other changes. The dynamic is totally different. Now you're taking care of me and I don't want to step on your toes, but I really need you to show up. But I mean, so many, like, something that you would think is pretty straightforward and basic ends up being like a big deal, touchy and sensitive. So
100%. Yes. You said that perfectly. Which is also one other thing I wanted to touch on, since you're saying that when you are working with an agency, it's always so good for there to be one designated person in the family to be the contact person with the agency, right? Right. You have a whole bunch of siblings managing moms there. When I see families divide up responsibility, it goes so much smoother, right? This one's in charge of the money. This one's in charge of the doctor's appointments. This one's in charge of, dealing with the agency and the schedules and whatever. So when we have like multiple siblings calling about the same parent, it gets very confusing and things don't go smoothly. They don't go simply because this one says we should do this thing and this one says we should do another and this one says we should change this, but this one said we shouldn't. So I always say, like, there should be one designated person in the family to deal with the agency, and any communication that needs to be had about the relationship, the schedule, the money, it should all come through that one designated person. This way on our end also, if we need to communicate with the family, we know who our person is. We're not calling all the numbers. We have that one person that we have built a relationship with. We understand, her mom's needs. We understand from her point of view, what she's dealing with, what she's managing when it comes to her mom. So it's always good for everybody that there's one designated person in the family to deal with the agency.
Right. Yes, I agree. I was just recommending this to a family member. Like, everyone needs to do their own thing and not 5 people calling the attendant, asking her when she's coming and where her notes are and what did she do. And it's like that she has to talk to everybody. It can get a lot.
It can be a lot. Yes.
Get a lot. Okay. I feel like I asked all of my questions, which is pretty impressive. Usually I ask only some of them, or no, I got all my questions asked. Is there anything, before I let you go, is there anything else that you wanted to add to the conversation?
No, I think we touched upon everything.
I think we were pretty thorough. And you know what? It happens to be a topic I'm very interested in. So I think that the listeners will definitely take note of that in the way that I ask so many questions. Even though it's something that I professionally, and but it's still interesting from a different perspective. I dealt mostly with CNAs that we hired directly. I didn't work as much with agencies. That's why you and I only have sort of like a passing acquaintance. Because I did work with you a little bit, but mostly I dealt with, so it's completely different. And I really appreciate your time. Thank you so much. I'm glad we were finally able to make it. I think 3rd time's a try, 4th time's a try.
Yeah, thank you. Thanks for having me.
No problem. Thank you. Have a good night.
Have a great night. Bye.
Bye-bye. Views expressed by me, your host, and my delightful guest are not necessarily reflective of each other's views, ideas, or life choices. Sometimes we're on the same page, and other times we're not.